At Women's Health Wednesday, it is National Stroke Awareness Month. 1 in 5 women between 55 and 75 years old will have a stroke, and stroke kills more women than men. And that's why Dr. Colin Hirst of Albany Associates in Cardiology is with us this morning so we can better help ourselves. Dr. Hirst, thank you so much for coming in and talking with us about this.
Well, thanks for having me.
Great to have you here. You know, when I hear that women are more affected, it kills more women than men, I should say. Why is that?
Well, you know, I think that we take a look at risk factors. Risk factors that are the typical are going to be across the board for men and women.
Sure.
High blood pressure, high cholesterol, obesity, potentially smoking. You know, but the additive risks are going to end up being the changes in hormone environment after menopause, and then additionally cardiac abnormalities, potentially cardiac dysrhythmia, atrial fibrillation, looking at population statistics. You know, patients that end up, sex, for instance, female sex is a negative prognosticator when it comes to the development or potential development of stroke as a consequence of atrial fibrillation. So, you know, certainly there are different risk factors for women as compared to men. So
we really need to pay attention here. What can we do? And I know obviously your background is cardiology, so speak to me a little bit about that.
Yeah.
How important that is to make sure we're checking up on ourselves.
Well, certainly. I think that the important part is engagement with your healthcare provider, and making sure that there is regular checkup for some of the widespread risk factors. As I mentioned, high blood pressure, high cholesterol, obesity, diabetes. These are all risk factors, you know, that affect heart disease, cerebrovascular disease. Additionally, I think that it's just important to end up having a sort of not only that engagement, but also some attention to some of the stroke symptoms. You know, the quicker that you act, it's going to end up potentially being more favorable for intervention.
Yes, and I know there's that acronym, FAST, right?
Correct.
Talk to us about that and how we need to really pay attention to that.
Yeah, and I think that that's really important because, you know, typically we talk about face slurring, face drooping, arm weakness, or one arm or sensory motor loss of the upper extremities, and then also speech slurring, difficulty finding words, generating words. And then seeing those, then it's time to call 911. Right. So FAST, that acronym FAST. You know, but sometimes it's just difficult, especially in women, that are subtle changes, subtle symptoms that should be picked up on.
Like what?
You know, changes that are in equilibrium, looking at the horizon, not feeling like you are totally balanced on your feet, out of the blue, nausea, vomiting, just generally feeling not well. Right. And some of these in constellation, along with some of those symptoms that I had mentioned previously that are found, you know, in many different settings of stroke, you should have a little bit more attention, especially in a vulnerable patient population, for instance, women.
Yeah, and I mean, stroke is essentially a brain attack, right? You know, part of the blood supply to the brain is cut off.
You bet. And, you know, in cardiology, we end up saying that time is muscle. So the quicker that you act, time is brain. And so picking up on some of these hallmark symptoms and then notifying the appropriate medical personnel, as well as engagement with either your primary care provider, cardiologist, or emergency department, is really going to end up helping to, you know, save the brain attack.
What about the Watchman? Talk to us about that, this device that helps a certain segment of people who are at risk.
Yes. So I had mentioned one of the risk factors is atrial fibrillation. And atrial fibrillation, there's a number of different risk factors that increase stroke, and age, sex, vascular disease, the presence of diabetes, or the presence of a prior stroke, you know, all increase the risk, and that aggregate increases the annual risk of stroke. And it just so happens that women are at greater risk than men of having a stroke. And so this is a potential way for us to reduce stroke related to atrial fibrillation. In fact, the device helps to almost eliminate it. In 90% of stroke related to atrial fibrillation is due to clot formation in a small portion of the heart. And the Watchman device essentially ends up being a plug. It plugs up that hole where clot develops. It helps to exclude that, and it helps to reduce the likelihood of clot development in that small portion of your heart. And that's one of the procedures that myself and my colleagues do at St. Peter's Hospital.
Dr. Hirst, we appreciate you coming in so much, an important topic that we know that we need to make sure women are aware of.
Yes.
Thank you so
yes.
much for coming in.
Thanks for having me.
And we have all of our Women's Health Wednesday segments online. You can go to news10.com and look for Women's Health under the Community tab. We send it to Ryan now.